afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor of Madison365, with your daily update for Monday, September 21st. Support for Madison365 and for your daily update comes from Milwaukee Film, presenting the Minority Health Film Festival now until Thursday. It's been going on since the 10th. Lots of good films to screen, and you don't even have to go to Milwaukee for it because they're all in the app, like Netflix style, and it's pretty cool. So check that out, mkefilm.org/MHFF. Support today also comes from the City of Madison Complete Count Committee, encouraging you to fill out your census in order to continue to be counted, and to make sure Madison and or your community, wherever you're from, gets your fair share of representation in the federal government, as well as in the state government, and in resources from federal and state governments. And that's at my2020census.gov. The news today on the coronavirus front is not, it's not any better really than it has been in the past several days. As you recall, we've basically, the past 4 days have been the 4 highest new case counts to date. Thursday, Friday, Saturday were all over 2,000. Sunday was about 16, almost 1,700. Today we're at just over almost 1,300. We're at 1,271 new cases on Monday, but that's with fewer than 6,800 tests, that's the raw number of cases is always low on a Monday. It's usually low on Saturday and Sunday too, but not this weekend. But usually there's a day of catching up of reporting results. There's also some reporting or some catching up that needs to be done in terms of reporting negative tests. So we know there were 6,800 tests. Obviously, a lot of those are negative. There were probably a few hundred more tests that were negative that are not included in today's data. So the positive test rate right now, as it stands for today, is 18.7%. There's a good chance that that's actually somewhat lower because there are probably 200 or 300 other more tests that didn't get reported as negative. But that would only drive it down to like 17%, which is still bad. Which is why we don't really want to focus on just one day's numbers, but like today's numbers are important because they add to the story that we've been seeing play out over the past several weeks, which is to say that it is the 17th day out of the past 18 where we've been over 10% in terms of the percentage of tests that come back positive. And, adding in those couple extra 100 negative results is not going to drive us down below 10%. And the one day that we were below 10%, it was 9.7. So really would have rounded up to 10. So you could say for 18 straight days, we've been roughly 10% or more. We spent a couple days over 20%, in fact. To just give you some context for that, back when I a long time ago now, in like June, I think, when I interviewed Dr. Sethi from the UW, epidemiologist, he said you could open schools if that was 2%. Because if you're at 2%, that means there's not significant community spread. You've got it isolated. It's still spreading a little bit, but you kind of know where it's spreading, and you can kind of cut it off before it gets any further. When you're in the 15, 16, 18, 20% range, you really shouldn't be opening anything, but here we are. We have now 14,400 cases are active, which is probably just a function of the large number of cases we've been seeing. It's just that, like, a certain number of them obviously will have been it will have been diagnosed in the past 30 days. We've been seeing large numbers for the past like 3 weeks. So obviously a lot of those numbers are going to remain active for some time, right? For at least a month. So that's 300 more than yesterday. That's one of the many measures, that we don't have this under control. Like that, like the number of active cases, when you're on the other side of the curve, the number of active cases goes down every day. That's what happened earlier. That's what happened in June. It went down every day. It went from 9,900 down to 4,800. And then it has gone back up steadily since then. Now we're at 14,400 active cases. Again, rather than look at just today's numbers, though, let's look at trends. Over the past 7 days, 17.1% of tests have come back positive. Over the past 14 days, 16.1% have come back positive. Both of those numbers are very bad. Over the past 7 days, the average new cases is 1,792. And over the past 14 days, the average new cases every day is 1,540. None of those numbers means a lot on its own. Put them all together in the context of all the other numbers, the situation is kind of dire right now in terms of the spread of the illness. Now, does that translate? What does that mean? Like, is it we know we have a lot of people getting sick and a lot of tests coming back positive. A high proportion of the tests that we run are coming back positive. Is that in itself a bad thing? When the death rate is 0.5%, I would say yes, that's a bad thing. Because that 0.5% sounds like a small number. It is considerably higher than seasonal flu. Seasonal flu is like 0.0002%. Maybe it's 0.002. It's very small anyway. So no matter what the fatality rate is, if it's a percentage, there's always like some percentage of cases who will die. The more cases you have, the more death you have, obviously. So it is true that the more cases you have, the more people will die, and we don't want that. So the fact that these cases are spreading, in that sense, is bad news. The other thing that's bad about it is that we do have this thing right now where if there's any number of cases identified in a school or in a workplace, or there's an immediate impulse to go online or close the schools. So even if the virus itself is not killing anybody, it's disrupting lives, right? It's disrupting businesses. So for that reason, the spread is also a problem. Now, we do have 2 new fatalities today. And it's reaching areas that we haven't seen much before. Adams County had 3 deaths before. Now they have 4. It's a very rural county. And then Florence County today had its first fatality. I believe there are 11 counties in Wisconsin that have not yet had a death. So that means to say that this thing is spreading everywhere in the state and is causing death everywhere in the state. It's also causing long-term health effects. We know that about 20% of people who get it will have some sort of long-term effect. Permanent effect, we don't know yet, but that are about 20% have symptoms that linger for more than a month or 2. Breathing problems, heart problems, kidney problems. So in that sense, the fact that it's spreading is bad news. The other piece of bad news today is hospitalizations. Now, I just to make sure that I was saying this, that I was being accurate about this, I took a look at the hospital capacity, and it is still true that we are not really at this moment in danger of overwhelming hospitals. It seems like overall we have enough beds available with wiggle room. You know what I mean? Like there's, I'm trying to see if I can get this up. Basically, right now there are 433 people in the hospital, which is 25 more than yesterday. 26 more than yesterday. Sorry, 90. And incidentally, the highest since April 14th when we had 443 hospitalized. The highest level of hospitalization on any single day, April 9th, we had 446 people hospitalized. So we're not quite there yet. But even then, we still had plenty. I mean, that's back in April is when we were talking about building like a field hospital in Milwaukee and a field hospital in Madison, as just like at that moment, it was going up so fast. It went from 192 people were hospitalized on April 2nd, and 446 were hospitalized on April 9th. So 1 week, it went up like more than doubled in a week. So at that moment, in April, you're like, thinking this could be a really horrible situation if this keeps going up. So that's when they were talking about field hospitals and things. Thankfully, it didn't. It peaked at 446 and then it's basically gone down and then back up and back down and back up since then. Has never again reached 446. I think as we've learned more about the virus and how to treat it and what symptoms are the most troublesome, we've been able to, basically early on, they were like, a lot of, anybody who had any serious illness with COVID got hospitalized. That might not be so much the case anymore. But we do have enough capacity. We have, even with those 433 people in the hospital, and 131 of those are in intensive care. Across the state, we have 336 ICU beds immediately available. We have 161 intermediate care beds available and over almost 1,200 medical and surgical beds available immediately. That's across the state. A hospital bed in Superior doesn't help somebody in Racine, But as an overall picture of the healthcare system in Wisconsin, we're not at that point yet. However, it is important to note hospitalizations because it's just a measure of the severity of the illness. And this is basically what we're seeing in hospitalizations right now reflects the last 3 weeks of increased cases. Like, it makes sense that 3 weeks ago we start to see test rates over 20, over the 10, 15, 20% range. When we start to regularly see over 1,000 new cases, of course, you're going to see an increase in hospitalizations. Now, for us to have, 1,200 new cases and only 26 new hospitalizations. Well, we don't have 26 new hospitalizations. We have 26 people more in the hospital than we had yesterday. We had more than 26 people went into the hospital, but then also some number were discharged. So we have a net increase of 26 people in the hospital. But to have that net increase be, 26 is not a huge proportion of 1,200, right? So that's okay. But it is important to keep an eye on deaths and hospitalizations as the sort of the echo effect. Now let's talk a little bit about some localities, and then we'll get to questions. For the first time, our leading county is Winnebago. 129 new cases today. Now that is the home of UW Oshkosh. UW Oshkosh's. How do you how do you do a possessive on Oshkosh? UW Oshkosh's dashboard has not been updated since Friday. So we don't know how many new cases UW Oshkosh has identified specifically, but we know that the state is reporting 129 new cases today in Winnebago County. We also have several counties that have ridiculously high percentage of positive tests, which is what leads me to believe that today's overall percentage of positives is probably driven by a lack of negative tests being reported. So, like, for example, Brown County is 79 new cases, 98.75% positive, which means that are only reporting a total of, let me get my spreadsheet up here. They were only reporting a total of 80 tests. So they did 80 tests and one of them was negative. I have to believe that they did more than 80 tests, and just it being a weekend, it's just taking a couple of days to get, and the negative tests run through this different system. So there's probably, some number, probably a relatively small number, but some number of tests, negative tests that didn't get reported. So that's probably a little bit inflated. Now you look at something like Dane County, 80 new cases, but only 6% positive tests, which is actually very high for Dane County. Dane County is usually in the 2-3% range, or they used to be. Douglas County, Superior, 12 cases, but 92% positive. Eau Claire County, 31 cases, 97% positive. Grant County, good for you, 10 cases in Grant County, not good, but 2.3% positive tests. So that's very good. That might also be a little bit of catch up from the day before. So they might have had actually inflated numbers of negative tests that had come in from previous days. Manitowoc County, where Vice President Joe Biden is today, making a visit. 21 new cases, 91% positive in Manitowoc County. Oconto County, 23 cases, 100% positive tests. That's, again, suspicious. Racine County wasn't even on the list yesterday. Today they have 87 cases, 97% positive results. Again, probably there's some number of negative tests that didn't get reported. Okay, so those are kind of the highlights. Go look at the website, Madison365.org, for the complete list of counties with the high case numbers. The UW school counties continue to be high. Shawano County continues to be really high, 14 new cases today, 82% positive tests. Okay. I'll take a couple of questions, then we'll talk a couple of other news items related to coronavirus. Linda says we can't close bars because there's no new economic support for businesses or individuals. Stephanie and I, Stephanie, my wife, who does our data for us and outreach and things, and co-hosts the It's Only 10-Minute podcast with me. We were having this conversation yesterday, and I was kind of saying, like, we just got to figure out a way to just close this stuff. We got to take a year off of school, close down the university, close down everything. And she's like, you can't without federal money. Like, if the federal government could just write a check to all the colleges and say just close, and as Linda says, give some economic support and another round of either PPP funding or just grant funding to say this will get you through the next 6 months, then we could close them all, but we just can't hang them out all to dry. Cameron says his son-in-law showing symptoms in urgent care on Saturday, and they refused to test. He did get this at another facility. Cameron, can you comment? Can you add to your comment where that was or what county that was in? I'm curious. I'm pretty sure Dane County, they're pretty much testing everybody. But I'm curious what county that would be. Okay. That seems to be all the questions. So a couple other things I'll mention. There is a bit of a beef brewing between Dane County and the University of Wisconsin. Joe Parisi, the county executive, keeps putting out press releases and sending letters to the university saying, please close, please send students home. And today, Chancellor Rebecca Blank responded and basically said, the students are here, you can't wish them away, nor should you. It has to take more than just press releases. We should really partner. And she's also said, the county and the UW should partner to stem the spread of this thing. And she kind of took a shot back at him and said, the entities that are able to enforce the guidelines should do so, which they said last week that they're going to start to do. They being PHMDC, Public Health Madison-Dane County, said last week that it was going to really start enforcing its orders, actually finding businesses who are over capacity, that kind of thing. it seems to me, just kind of off the top of my head, without expressing too much opinion here, that the time for partnership was like before you open. You know what I mean? I just now, while you're sitting here, received an email back. So I asked this question: like, was there partnership before they opened? Was there discussion before UW opened? Did UW seek the advice of Public Health Madison-Dane County? And I just now received an email back from Public Health Madison-Dane County. It says, and the public health director, Janelle Heinrich, had numerous conversations with UW officials expressing concern about the return of students. So this sounds to me like it was, we could partner, we want to partner, and when we did partner in talking about how to open again, and we told you don't. Or we expressed concern. I don't know if they can say don't open, but they can express concern, and they did so before UW opened. So now we're at this place where the county is doing a little bit of told you so on the UW. So I will continue to follow that. I'll look into it a little more. All of their emails are public record. So it was public. There was a public side of it, but Parisi didn't really come out hard until the university was already in session and starting to show cases. I'm curious about the conversation that they had sort of behind the scenes leading up to the decision to open, and any written communication that happened is public record. And I'll try to get my hands on that and see what those conversations were like and what kind of advice PHMDC gave UW. The Center for Disease Controls and Prevention has had an interesting couple of days at the federal level. On Friday, the CDC website updated its guidelines and basically acknowledged what we all know, that coronavirus, SARS-CoV-2, this virus that causes COVID-19, is transmitted in the air, not only in droplets, but in aerosol, meaning just breathing can, and talking at a normal level can spread the disease. You don't have to cough on somebody, in other words. And it can spread itself outdoors because in aerosol form, it floats for longer periods of time. Which it's nice to see the federal government actually acknowledge that. Have I frozen? Somebody comment, tell me I haven't frozen. I'm looking at myself and I look frozen. I'll keep talking and just in case I'm not frozen for you. But then today, they reversed that. And that whole thing about, it spreads through the air was taken off the CDC website. And the explanation was that it was a draft. Thanks for telling me I'm not frozen, guys. You guys are the best. Anyway, the explanation was that it was a draft, that somebody wrote a draft on Friday of a draft of new guidelines and accidentally published it, which is, how to say this delicately, not true. There's no way that's true. In journalism, we are taught not to speculate and not to think of what would happen, but think only of what did happen and what we have evidence for and what the facts that are on the table. But here's the thing. I've been in government PR. Okay. I've been in government communications. I've been in that area. Not for a long time in my career, but enough to know that if you accidentally publish a draft, it doesn't take 4 days to bring it down. if you accidentally publish a draft or something, you fix it immediately. For it to go on an entire weekend, for it to be up there an entire weekend, be reported on widely, like it was reported on Friday, on like CNN, on national press, which everybody at CDC, everybody in the White House would have seen, right? It took them 3 days to decide to take it back and to come up with a story about why it got published in the first place, which is to say that it was draft, like that was their story. They're sticking to it, which is bonkers and ridiculous, if you ask me. So it seems as if the CDC is a little bit compromised by politics. Don't know why. I don't know why. I honestly don't know why. But anyway. Another interesting coronavirus story out of Kenosha that I haven't been able to look into very much yet. But Kenosha has had to pivot to online learning suddenly because all the teachers called in sick. Not all of them, but almost 300 teachers called in sick. Today. There's been a movement to open all schools with no virtual learning. There's been a movement among teachers to go all virtual. They want to open schools, but only if it's safe. And it's not exactly a strike, but we've seen sick out and wildcat strikes kind of be really effective in recent years. So we'll keep an eye on that developing in Kenosha. One last thing I'll mention today that has nothing to do with coronavirus is it is time once again to publish our Si Se Puede list, which is our list. It's our fifth annual. Yes, our fifth annual. I couldn't remember if it was fifth or sixth. Fifth annual list of the most influential Latina leaders in the state of Wisconsin. There are 39 this year on our list. The first 7 are up this morning, along with a little introduction, kind of framing it. And so I'm going to put a link in the comments right now. Take a look at that. Watch every morning at 6 a.m. A new segment of the list will be published. These are folks from around the state. These are men and women, and they're in all sectors. There's people in arts, people in attorneys, government officials, entrepreneurs of all kinds. And it's really fun to get to know those folks and people you've heard of, people you've never heard of, that are doing really impressive work and exerting a lot of influence both inside and outside the Latino communities in Wisconsin. We've done this for Black leaders every year. And then we've done it for Black and Latino leaders every year we've been in existence. And then this year we've just been finally able to do it also for Native American and Asian American leaders. So that's exciting. It's always an exciting time when we get to do that list. So take a look at that and keep an eye out the rest of this week. Every day this week, there's going to be a new section. And the growing out of those lists, when we started, that we realized that those people on those lists didn't know each other. And we decided at some point must have been 2016, 2017, that we had to get all those people in the room together, like in the same room. So we launched the Wisconsin Leadership Summit in 2018, bringing together all those people who've been on those lists, as well as anybody else who wanted to come learn from them, interact with them, network with them. Obviously, this year we can't all be in the same room, so we're doing it virtually, October 5th to 9th, where you can register now. It's wisconsinleadershipsummit.com. We're announcing moderators every day of panels. We have 25 panel discussions, and we're going to have some other events and other stuff that we're going to announce later this week. It's going to be very exciting. $79 for the whole week, $49 if you're a nonprofit employee or a government employee, $20 if you're a student. Highly recommend it. The 2 that we've done so far that were in person were really exceeded expectations for me, certainly. Really good chance for us white folks to sit back, listen, learn. Really a great chance for people to network. It's a really solid professional development opportunity. You can definitely convince your employer to pay for it, probably, because it definitely is professional development. So give that a shot. I highly recommend it. Appreciate your attention today. That's all I have for you. It is it is now 4:30 and time for me to start thinking about getting dinner ready and retrieving the kids from the park. So thanks again. Have a wonderful evening, and we'll see you again tomorrow.